How can we improve healthcare models, the delivery of healthcare, or the entire healthcare system in the United States? Lots of people complain about it. I believe we have one of the greatest healthcare systems on the planet Earth. And if you have visited other countries, you might agree. But I think we can do better. And I'd like to propose something to you and to the world based on research. We hear these beautiful words in the hallways of academia, but they very rarely trickle down to the policy level and the community level and the practical, everyday use level. I'm Dr. Jim. What the heck am I talking about? I'm talking about this. A life course approach to healthcare in the United States. A life course. I'm 10, I'm 20, I'm 30, I'm 40, I'm 50, I'm 60. Not yet. But I have different mental health needs at different decades of my life. I have different, preventive measures to take. I have, dealing with chronic conditions at certain ages. I think we need to do better than just fix broken bones and prescribe and cut and sew. There are better ways. Allow me to introduce a life course approach to healthcare in the United States. Despite the many improvements in healthcare models and the dawn of integrated health in the United States, the need to provide timely and appropriate care to older adults managing medically complex conditions over long periods of time and throughout different stages of their life course is still greatly needed. I'm a gerontologist, so this is important to me, but it's important to all of us. It can be said that a number of healthcare models linger from the second half of the 20th century that primarily focus on infectious diseases and major medical events like heart attack, stroke, and diabetes. That's what our hospitals are set up for. A better healthcare model might be, and I love this combination of words, person-centered care with a life course approach, which would respond to the needs of older adults and improve life expectancy. Boom. There's a lot there. What is a life course approach for older adults? What am I talking about? While these words rang true to me in college, graduate school, throughout my PhD, every campus I've ever been on, the words life course approach have been used theoretically and academically in college classrooms and hallways and lunchrooms. But they fall flat when it comes to policy and implementation within the community setting, especially concerning health care models and delivery of health care. A life course approach takes into account a person's stage in life as well as the many transitions from year to year or decade to decade, all within a social context, wherever we're living, the city, the state, the country, the government. Everything takes place in a social context. For instance, the medical or psychiatric needs of a 21-year-old would barely match those of an 85-year-old. And the current state of healthcare delivery in the United States still favors fixing broken bones, prescribing antibiotics, etc., over age-appropriate care throughout one's life course. See what I mean? What are elements of a life course healthcare model? What would it look like? Okay, life course, delivering appropriate medical, psychiatric, emotional, blah, blah, blah care at certain stages throughout a person's life. The 20-year-old doesn't need what the 40-year-old needs. The 90-year-old doesn't need what the 10-year-old needs. Okay? A better approach to delivering care at various stages of life would, in fact, focus on certain domains of health needs: physical, behavioral, cognitive, mental, so on and so forth, at various stages throughout a person's life course. This approach would involve the following elements. Okay? Number one, monitoring and promoting optimal health and abilities at certain ages or stages of life while identifying risks of decline early enough to implement preventive or rehabilitative interventions. We're getting to the problem before the problem really gets worse. 2, risk and disease management, problem's already there, of chronic conditions, multimorbidity, which means a lot of healthcare issues, very complicated health care problems, polypharmacy, I'm on a lot of prescription meds, and other geriatric conditions. Okay, so now we're zoning in with precision healthcare. 3rd, develop supportive environments that enhance quality of life, well-being, functional capacity, and equity on health outcomes. That would involve community services. 4th, empower people to make informed health decisions. Improve health literacy. I rarely talk about this. Slap, shame on me. Our health literacy in the United States is not that great. Health literacy literally means I know quite a bit about health, mental health, physical health, well-being, prevention. I know what types of services are out there. I know where to go. I know the resources. I know where to get help. I know how to do it quickly. So many folks don't have that information. They really don't. So what do we need to do? Teach self-care through individual, family, and strong community engagement. Those 4 elements, I think, and I'm not alone on this, a lot of gerontologists and researchers out there are looking at this very seriously and saying, we have an aging population. We're going to keep aging for the next 2 to 3 decades. So we need to do something here. Maybe 4 decades. Each of these domains is meant to create better health outcomes over the course of a person's life. That's all we're trying to do here. They're also meant to preserve capacity and functionality based on the person's life stage, their values, preferences, gender, culture, and so many other important personal and social factors. Remember, person-centered life course approach. Makes too much sense to me, doesn't it, David Bowie? Everything is better in a David Bowie mug. Excuse me for a moment. Every time I say Bowie, I start talking British. I apologize about that. Here are my final thoughts on a life course approach to healthcare in the United States. Health and medicine have come a long way in the United States. There's no doubt about that, and will hopefully continue to improve over time. One model of care, though, that may help now and in the future is a person-centered life course approach to healthcare models and delivery, which provides the right care at the right stage in life. That's all I had to say about this whole darn thing. The right care, the right stage of life. It can also help to prevent, though, or delay onset of a number of diseases like cancer, heart disease, Alzheimer's, diabetes, stroke, all the things that Americans are dying from. As the aging population grows, there's an immediate need for a better healthcare model. One that doesn't just reverberate through those halls of academia, but right here on the ground, in the community, in policy and in practice. I'm Dr. Jim. That's my beef today. I hope you enjoyed a life course approach in healthcare in the United States. Please check out, I've got so much going on online. Collins Learning, CEU Academy, drjimcollins.com. And if you're interested in chatting with me sometime, my email address is easy, jim@collinslearning.com. Well, I hope you enjoyed the video because we have so much more to offer if you are looking for an online learning partner for your staff, compliance requirements, continuing education, tracking, reports, the ability to share documents, send messages, even track training that you're doing outside of the system. Collins Learning is waiting to become your online learning partner, and you will receive best-in-class customer service and support. So follow the link below. Check out Collins Learning today.